video, we're going to show you a couple of techniques for genitourinary assessments. Now, it's really important to note that these assessments are usually deferred, either completely because the patient has no GU complaints, or at least until time for their bed bath or pericare. Make sure that you know your facility's policy on this, but also just make sure you're preserving your patient's dignity at all times. That's usually why we defer, so that we don't have to expose them multiple times when it's not necessary. So for both male and female patients, you want to start by just asking them if they have had any issues with burning or urination. This is going to be your first clue that something's up. You should always tell the patient what you're doing and get permission to do the assessment. So for female patients, it's also important to ask about their menstrual history and when their last menstrual period was. You'll start by examining the external genitalia. The labia majora should be symmetrical and well-formed with equal hair distribution. You also want to palpate the labia for any masses that could indicate blocked ducts. Then you want to use 2 fingers to gently spread the labia majora so that you can inspect the clitoris and the labia minora. They should be dark pink and moist and also symmetrical. Then you should inspect the urethral opening and the vaginal canal for any drainage, bleeding, redness, or swelling. Make sure you also make note of any odor. When you're done, make sure that you cover the patient back up to protect their privacy and their dignity. Of course, with these types of assessments, it's always appropriate to get a chaperone or offer a chaperone if necessary. Now for males, we also start with inspection. You want to look for any discharge or bleeding at the tip of the penis. You're also looking for any lesions on the penis or scrotum. You're looking at vasculature and hair distribution as well as the general shape for any abnormalities. You also want to look at the inguinal region for any bulging or masses that could indicate a hernia. And then you move to palpation. Gently palpate the testes between your thumb and first finger on both sides. They should be oval, they should move freely, and they should be only a little tender. Again, as always, cover your patient back up and make them comfortable. Make sure you're always being respectful of our patients when we're doing these types of assessments. They are a bit more sensitive and a bit more private. Sometimes if we just ask the right questions, we'll know whether or not the physical portion of the assessment can be deferred or not. Now go out and be your best selves today, guys. And as always, happy nursing.